Hello friends, let us now learn some important points about the thyroid inhibitors. In the thyroid inhibitors, the first group of drug is sodium iodine Symport inhibitors. These include thiocyanate, perchlorate, fluborate, pertecnate and nitrates. Thiocyanate causes side effects of neuropsychiatric side effects. Perchlorate causes a side effect which is aplastic anemia. All these are toxic, so are not preferred. Thiocyanate is produced from cabbage, cigarette smoking and sodium nitroprusside. Then the next group of drugs are thyroid peroxidase inhibitors or Amide drugs. So these will bind to the, as the name says, they will inhibit thyroid peroxidase. So they will first bind to the thyroid peroxidase and thus prevent the oxidation of iodide to iodine. So thus it will inhibit the iodination of tyrosine residues, and it will also inhibit the coupling of monoiodothyronine and diiodothyronine and thus decrease T3 and T4. Overall, there is decreased synthesis of thyroid hormones. Propylthiouracil also inhibits the conversion of T3 to T4 peripherally, whereas the drugs methimazole and carbimazole has no effect on this T3 to T4 conversion. Pharmacokinetics they are oral drugs which are distributed in the body, enter the milk, cross the placenta. They are metabolized by the liver and excreted in urine, and they are concentrated in the thyroid gland. They have a lag period of 1 to 3 weeks is present, and so this lag period is present due to the depletion of thyroid stored T3 and T4. So in order to for them to come back, when you stop these thyroid peroxidase, for the thyroid function to come back to its original position, it takes almost 1 to 3 weeks, because these hormones will deplete the stored T3 and T4. So for our body, in order to replenish the stores of T3 to T4, it takes 1 to 3 weeks. Then the side effects include, it causes GI tolerance, allergic dermatitis. So if you see the serious advantages, like disadvantages include agranulocytosis, others like skin rashes, joint pains, loss or graying of hair, loss of taste and fever, and liver damage is seen. If you see the uses, it is used in the definitive treatment of Graves' disease and toxic nodular goiter. It is also used pre-operatively in surgery in thyroid patients. So if you see the drugs, we have two different types of drugs which are propylthiouracil and carbimazole. Carbimazole is the prodrug of methimazole. So propylthiouracil is short acting, whereas carbimazole is long acting. Propylthiouracil requires multiple doses, whereas carbimazole requires single doses. Side effect of propylthiouracil is hepatotoxicity, whereas carbimazole it is teratogenic. You will also see presence of choanal and esophageal atresia and cutis aplasia in carbimazole. If you see, the drug of choice in pregnancy is propylthiouracil, whereas drug of choice of hyperparathyroidism is carbimazole. Propylthiouracil is mainly used in the first trimester of pregnancy, whereas carbimazole is used in second and third trimester of pregnancy. Propylthiouracil can be used for Graves' disease and breastfeeding. In breastfeeding state, propylthiouracil is preferred, whereas carbimazole is less preferred in breastfeeding. If there is severe thyrotoxicosis or thyroid storm, then the drug of choice is propylthiouracil, which will inhibit the conversion of T4 to T3, and carbimazole is almost 10 times more potent than propylthiouracil. Then we have the next important drug, which is Thiol endopeptidase inhibitors. So this group of drugs, which is Thiol endopeptidase inhibitor, so here when there is release of iodine in the intestine, it gets converted to iodide, which in the thyroid it forms iodine. But if iodine is given in excess, there is increased iodine in the intestine which goes into the thyroid, which increased iodine in the thyroid will inhibit sodium iodine symporter, and thus there is decreased intake of iodine into the cell. Whenever there is increased iodine, it interferes with iodination of tyrosine, thus causing or normal thyronil residues of thyroglobulin, thus causing decreased T3 and T4. Increased iodine also decreases the TSH and cyclic AMP induced thyroid stimulation. If you see the contraindications, the contraindications include: it is not used in pregnancy, in fetal goiter, and in hypothyroidism. We do not use these thiol endo peptidase inhibitors. The side effects include: acute side effects are only in sensitized individuals to iodine. These are hypersensitivity side effects like swelling of lips, eyelid, angioedema of larynx, fever, joint pains, petechial hemorrhages, thrombocytopenia, and lymphadenopathy are seen. Then for chronic or in iodism, you will see inflammation of mucous membrane. Whenever there is chronic or iodism, you will see inflammation of mucous membrane, salivation, rhinorrhea. Then we can also see sneezing and lacrimation, burning sensation of mouth, headache, and GI symptoms are seen in chronic iodism. Then for long term side effects include hypothyroidism and goiter are the long term side effects. Overall side effects include metallic taste in the mouth, dysgeusia. So this iodine also inhibits the vasculogenesis in thyroid. It inhibits the vasculogenesis in thyroid. It makes thyroid tissue firm and also decreases the size of the thyroid gland. So if you see the uses of this iodine, it is used prior to the surgery to decrease the complications during surgery. It is used in thyroid storm. Then iodine is used as an antiseptic and expectorant. It can flare up acne in adolescents. Then if you see, the examples are potassium iodide and Lugol's iodide. These are fastest acting anti-thyroid drugs and they develop tolerance easily. Then we have the next group of drugs which include radioactive iodine. Radioactive iodine has two isotopes mainly. One is iodine 123 and iodine 131. Iodine 123 emits gamma rays and is used in thyroid scan, whereas iodine 131 emits beta and gamma rays, and if you see, the beta rays are destructive and thus used in thyroid ablation. So in iodine 131 can be used both for treatment and for investigative purposes, whereas iodine 123 is only used for the thyroid scan. Now iodine 131 is radioactive. It emits gamma rays and beta particles also. It is concentrated in the thyroid. Iodine 131 emits radiation in the follicles. Now the beta particles will penetrate the tissue, and when the beta particles penetrate the tissue, it will cause pycnotic or pycnosis of the nucleus and necrosis of the cells, and finally it causes fibrosis of the follicles. It does not damage the surrounding tissue. It will just damage the thyroid tissue which it targeted. Then if you see the indications of radioactive iodine therapy: patient more than 35 years, heart disease, and if there is any contraindication of surgery, we can give radioactive iodine therapy. It is contraindicated in some disorders. Absolute contraindication is seen in pregnancy, and it is also thyroid peroxidase inhibitors should be stopped 4 days before starting iodine therapy. So it is absolutely contraindicated in pregnancy. That is one important thing. If you see the side effects, it causes permanent hypothyroidism. It also causes secondary cancer and hyperparathyroidism. Uses: it is used in hyperthyroidism in elderly and in arrhythmia cases. It is used in thyroid cancer except in medullary carcinoma of thyroid. It is used in Graves' disease because it will worsen the whenever there is worsening of ocular symptoms, steroids can be given 2 months before it. Toxic nodular goiter, you can use it. Relative contraindications include coexisting ophthalmopathy. So this is about the radioactive iodine. Next we have come to the last part. Then we will see some drugs which will inhibit the peripheral conversion of T4 to T3. So these drugs include, we have propranolol, propylthiouracil and amiodarone. These will inhibit the 5-deiodinase which will convert T4 to T3. Thus T4 to T3 conversion is inhibited. We have some adjuvant drugs which are used like beta blockers like propranolol, esmolol, atenolol. These will actually antagonize the sympathetic effects which are seen in thyrotoxicosis. Those sympathetic effects include tremors, tachycardia, palpitations and anxiety, which are stopped by beta blockers. Calcium channel blockers or diltiazem will block tachycardia, whereas steroids like IV methylprednisolone can be given for Graves' ophthalmopathy. Then we have to see the treatment of hypothyroidism. We have learnt about hyperthyroid drugs. Now treatment of hypothyroidism. We have two drugs which are available for treatment of hypothyroidism, which is levothyroxine and leothyroxine. Leothyroxine is a sodium salt of T3 which is short acting and it is orally available with 100% bioavailability. It can be given IV also. It is used in the treatment of myxedema coma and for preparation of thyroid carcinoma. It is also used in patients for iodine 131 therapy. Then we have levothyroxine. Levothyroxine is a sodium salt of T4 which is long acting. It is used in the replacement of hypothyroidism. It is because it is long acting, it is given OD before breakfast on empty stomach. So it is also used in thyroid cancer to decrease TSH in thyroid nodule if there is increased TSH, and it is also used in myxedema coma, especially in IV route. This dose of myxedema coma is calculated based on lean body mass. Then we have to learn some important points about levothyroxine. This levothyroxine in pregnancy, we will have to increase the dose of levothyroxine. Then if you see the side effects, this levothyroxine causes increased atrial fibrillation. It can cause osteoporosis, hyperglycemia and asthenia. Because it increases atrial fibrillation, the dose of this levothyroxine should be decreased in patients with arrhythmias. This is levothyroxine, LEVO, levothyroxine. Then if you see, oral bioavailability of these drugs is only 80%, so dose is decreased by 20% in IV route. So this is about the thyroid drugs. Thank you for watching.